Did you know that a simple vegetable, found in almost every grocery store, is being studied by researchers for its potential effects on blood sugar control? A recent scientific review combined the results of 14 randomized clinical trials involving more than 800 participants and found that okra-based preparations were associated with improvements in several important markers related to glucose metabolism. But does that mean okra can control diabetes? Or have social media exaggerated its benefits? In this video, we'll take a closer look at what the science has actually discovered, what results have been observed in human studies, what the limitations of the research are, and why this vegetable has attracted so much attention from researchers. It's important to remember that this video is for informational purposes only. It is not intended to replace medical advice or encourage anyone to substitute food for prescribed medications. Our goal is simply to present what the scientific evidence shows so far. The real problem: insulin resistance. Before understanding the role of okra, we first need to understand the underlying problem behind most cases of prediabetes and type 2 diabetes: insulin resistance. Imagine that every cell in your body is like a house. Glucose is the fuel that needs to get inside that house to produce energy. Insulin is the key that unlocks the door. When everything is working properly, glucose enters the cells without difficulty. However, over the years, factors such as excess body weight, physical inactivity, an unhealthy diet, genetic predisposition, and aging can cause the body cells to become less responsive to insulin. It's like trying to open a door with a rusty lock. To compensate, the pancreas produces more and more insulin. For a long time, this extra effort can keep blood sugar levels looking normal. But constantly working overtime eventually places too much strain on the body. As the years go by, the pancreas gradually loses efficiency and blood sugar begins to rise, leading first to prediabetes and eventually to type 2 diabetes. Insulin resistance is also associated with unhealthy cholesterol levels, fatty liver disease, chronic inflammation, and an increased risk of cardiovascular disease. That's why researchers around the world continue searching for strategies that may help improve the body's response to insulin. And that's exactly where okra started drawing scientific interest. Why did researchers start studying okra? For many years, okra was considered nothing more than a common vegetable. But scientists began analyzing its nutritional composition and discovered that it contains soluble fiber, phenolic compounds, flavonoids, and natural antioxidants. These compounds may act on different stages of glucose metabolism. That doesn't mean okra cures diabetes, but it does help explain why so many studies have investigated its potential health benefits. Perhaps the most interesting finding is that okra appears to work through more than one biological mechanism at the same time. What does the scientific research show? The strongest evidence available so far comes from a systematic review and meta-analysis that combine data from 14 randomized clinical trials involving a total of 836 participants. The studies evaluated different forms of okra consumption, including capsules, extracts, powders, and food-based preparations. Although the study designs varied considerably, several findings appeared consistently. Researchers observed improvements in important markers related to glucose metabolism, including reductions in fasting blood glucose in some participants, lower post-meal blood sugar spikes, a modest reduction in HbA1c, the marker that reflects average blood sugar levels over the previous 2 to 3 months, improvements in measures of insulin resistance, such as HOMA-IR, and in some studies, slight improvements in LDL cholesterol levels. These findings are certainly encouraging. However, there's one very important point to keep in mind. The researchers themselves emphasize that the benefits varied among participants and do not mean that everyone will experience the same results. There is also no standardized amount of okra that has been proven to consistently produce these effects. For that reason, okra should be viewed as a potential addition to a healthy lifestyle, not as a replacement for medical treatment. The first mechanism, okra's soluble fiber. One of the most distinctive characteristics of okra is actually something many people try to remove while cooking: its famous slimy texture. That natural gel is rich in soluble fiber and mucilage. Once these fibers reach the digestive tract, they form a gel-like substance. This gel may slow the absorption of glucose, allowing sugar to enter the bloodstream more gradually. In practical terms, this may help reduce blood sugar spikes after meals and decrease the need for large releases of insulin. It's important to understand that this doesn't prevent glucose from being absorbed. It simply slows the process, promoting a more balanced metabolic response. In addition, soluble fiber can increase feelings of fullness and slow stomach emptying, well-established benefits of fiber-rich foods. The second mechanism, effects on carbohydrate digestion. In addition to its fiber content, okra also contains bioactive compounds that have attracted researchers' attention. Whenever we eat carbohydrate-rich foods like rice, bread, pasta, or potatoes, those carbohydrates must first be broken down by digestive enzymes before glucose can be absorbed into the bloodstream. One of the most important of these enzymes is alpha-glucosidase. It plays a key role in the final stage of carbohydrate digestion. The faster this enzyme works, the faster glucose enters the bloodstream. Experimental studies have shown that certain compounds naturally found in okra may partially reduce the activity of this enzyme. In practical terms, this means that carbohydrate digestion may occur a little more slowly, helping to reduce blood sugar spikes after meals. It's important to point out that this does not mean okra works the same way as prescription medications designed to block this enzyme. Those medications contain standardized doses, have undergone rigorous clinical testing, and are prescribed by healthcare professionals. Okra remains a food, not a medication. It may serve as part of a balanced diet, but it should never replace medical treatment. What's particularly interesting is that these two mechanisms appear to work together. While the soluble fiber slows the absorption of glucose, the bioactive compounds may also slow the rate at which glucose is produced during digestion. This combination helps explain why okra has generated so much interest within the scientific community. Can okra protect the cells that produce insulin? Researchers have also investigated another intriguing possibility. Inside the pancreas are specialized cells known as beta cells, which are responsible for producing insulin. When someone develops insulin resistance, these cells have to work harder and harder to keep blood sugar levels under control. Over time, this constant workload can reduce their efficiency. For that reason, some studies have explored whether the natural antioxidants found in okra might help reduce oxidative stress and inflammation, two factors believed to contribute to the gradual decline of beta cell function. Laboratory findings have been encouraging. However, studies conducted in humans still do not provide enough evidence to conclude that okra directly protects the pancreas's beta cells. This remains an active area of scientific research. What about high blood sugar in the morning? Many people are surprised when they wake up with elevated blood sugar levels, even after eating a light dinner the night before. In most cases, this happens because of what's known as the dawn phenomenon. During the early morning hours, hormones such as cortisol and growth hormone stimulate the liver to release glucose into the bloodstream in preparation for waking up. In people with healthy insulin sensitivity, this temporary rise is quickly brought under control. However, individuals with insulin resistance may wake up with higher blood sugar levels, even if they didn't overeat the night before. At this time, there isn't enough scientific evidence to conclude that okra can control the dawn phenomenon. The available research has mainly demonstrated improvements in post-meal blood sugar responses and in certain markers related to insulin resistance. What can we honestly conclude? After reviewing all of these studies, the researchers reached a fairly clear conclusion. Okra has an impressive nutritional profile, and it contains compounds that may contribute to better glucose metabolism. Current research suggests potential benefits such as lower fasting blood sugar, smaller blood sugar spikes after meals, modest improvements in HbA1c, improvements in certain markers of insulin resistance, and possible benefits for some metabolic health markers. However, these findings still have important limitations. The studies used different preparation methods, different dosages, and different intervention periods. As a result, there is still no official recommendation regarding the best way or the ideal amount to consume okra in order to achieve these potential benefits. In addition, every person's body responds differently. What worked for some participants may not produce the same results for others. The bottom line, after looking at all of the available evidence, one thing becomes clear. Okra is not a miracle food. It does not cure diabetes. It does not replace prescription medications. And it does not eliminate the need for regular medical care. But that doesn't mean it should be overlooked. Because it's naturally rich in fiber, vitamins, minerals, and bioactive compounds, okra can certainly be part of a healthy, well-balanced diet. In some situations, it may even help support better blood sugar control when combined with other healthy lifestyle habits. Scientists continue to study its potential effects, and future research will help determine who may benefit the most and what the most effective way to consume it might be. Until then, the most important recommendations remain exactly the same. Maintain a balanced diet. Stay physically active on a regular basis. Get enough quality sleep. Manage stress as effectively as possible. Follow your prescribed treatment plan exactly as directed. And continue having regular checkups with your healthcare provider. It's this combination of healthy habits, not any single food, that makes the greatest difference in managing diabetes and supporting long-term metabolic health. We'd love to hear from you. Now we'd like to hear your thoughts. Do you eat okra regularly? What's your favorite way to prepare it? Has a doctor, dietitian, or another healthcare professional ever talked to you about the research on okra and blood sugar control? Share your experience in the comments below. I always enjoy reading your comments, and whenever possible, I personally respond. If you found this video helpful, please share it with friends and family members who might also benefit from this information. And if you enjoy science-based content about nutrition, health, and living a healthier life, don't forget to subscribe to the channel and turn on notifications so you won't miss our upcoming videos. Thank you so much for watching all the way to the end. I'll see you in the next video.